armamentarium. Yan. Okay, so we go on to your armamentarium, di ba? From hand washing to patient preparation, skin prep. So this is the next armamentarium. You prepare it kasi pag sterile na kayo, yung white gloves, sterile gloves. So, yan, labas nyo. Nakabili na ba kayo lahat ng instruments?
Yes,
And
po.
start looking for exo patients kasi by 21, exo day yun na. So, you have 2 weeks to look for your patients, sa mga wala pa. And then, kuhaan nyo na ng history. Kung may ano sila, yung history taking natin, just follow the old cards, yung mga patients' medical history, especially sa mga allergy. Kung may allergy patients sa medications and sa anesthesia. Kasi mag-a-adjust tayo sa kanila, sa patients nyo. And then, ayun, pag na-approve na kayo, send nyo sa amin, ako sa Facebook or kay Doc Jai, kay Doc Mendel, pero sa amin, sa residence nyo na lang ipa-approve. And then, pag okay na, pwede magsasend na tayo for clearance and laboratories. Okay? No labs, no clearance, no exo, ha? Yes.
Clarification. Hindi mo kung anterior.
Yes, di ba? At least 5 anteriors, pero kung may posteriors kayo, credit na natin sa anteriors. Ay, go! Baka mabigla lang kayo kasi nga 5 anteriors kasi iba yung feel sa anterior, single extraction sa tri-rooted sa posterior. Pero kung go, ganun talaga eh.
Doc,
Yes.
clarification natin po. Ano po yun? Record po na isang patient lang sa araw ngayon?
Isang patient kayo lahat, pero by partner kayo. So, one class, ipapaalam natin sa chief of clinics and sa seniors nyo na isang araw sa class nyo lang sa 21. Okay? So, tatapusin natin lahat yung exo nyo. May tally sheet na kayo lahat, di ba? So, lahat ng OS nyo doon, may signature na. Okay? Kung may patient kayo, kung gagawin yung patient nyo sa 21, yun. Kaya nga, tinutulungan na namin kayo, makahanap na lang kayo ng patient para tapos na yung OS nyo. Okay?
After po natin mag-bonus, pwede na po kayo mag-bonus sa company.
Yes! Kahit yung compre patient nyo, kung may exo,
Need. Ano yung need ipa-approve kayo?
para di na kayo mahirapan. Alam nyo ba yun? Lahat ng compre nyo, yun, pwede. Kung walang exo yung compre nyo, pero imposible namang wala. Kasi di ba rehab yan? Total rehab. Yun. Kung kailangan nyo ng top up, separate clearance yun. Pero kung compre nyo, at least isang clearance lang, isang gastos na lang sa patient nyo.
Required po talaga ng 5 o bago po mag-irmahan yung dati.
Di ba 4 yung kailangan pirmahan? At least 5 para alam nyo kung paano mag-multiple exo.
Paano raw ulit wala daw kayo
Sa flow.
Pag walang patient na, di maghahanap pa kayo sa iba. Pero syempre, every Monday lang kami nandito. So, tatansya yun yung... Maghanap na kayo, 2 weeks na lang, guys. 2 weeks pa. May ano pa yan, ang daming kailangan bunutan. Compre kasi yan, di ba? Ang requirement kasi ni Dr. Manalaysay, alima eh. Hindi man kami nilipay. Ilan yung kailangan pirma sa ano niyo, tally sheet? 4? Apat, isang OS, tapos 2 exo, di ba?
Dalawa po.
Dalawa po.
Dalawang routine exo.
Eh, di ba minimum ng isang compre ko?
May credit po ba yung work product?
Depende. Kasi kung susungkitin nyo lang yung fragment, iba yung thrill, iba yung excitement kapag ano eh. kapag may buo pa yung root niya. Ay, yung crown niya.
Let's say, ano po yung
Kung embedded pa yung RF, yun, pwede credited. Pero kung floating na lang, pero minsan kasi kahit RF, i-retrieve pa yan. Kailangan mo pa bone recordication. So, depende. So, prepare nyo yung ano nyo ha, emergency instruments and microphone. Okay na, may mga tanong ka? Oo, protocol okay. Ayaw namin makakita ng may calcular deposit ha, kasi nag-infection control pa kayo kung mismo yung sa patient nyo hindi stereo. Okay?
let's say, sobra po yung ipin ng bukolutan sa patient po or pwede po ba ibigay yung iba sa partner?
Kaso kung ilan yung sa partner nyo, dalawa lang. Ganon.
Hindi pa po sure.
Kung sobra, pwede naman siya i-credit for next clinic. Itatago nyo lang yung tally sheet kasi ay yung evaluation form kasi yun yung problema sa pag nag-sobra-sobra, nawawala na nila yung evaluation form. So, uulit ng EXO pa. So, kung kami, pwede nyo i-credit na lang for other clinics. Provided na hindi nyo iwawala yung evaluation form nyo. Okay? So, lahat ng evaluation form nyo, legal document kasi yan. So, itago nyo lahat habang nasa dental school kayo. Kasi syempre, pag nagpapaklearance kayo, pag hinahanapan kayo ng CI nyo, wala kayong ma-present, ulit ng case. Okay? Yes, ano mga itsura nyo? Kaya nyo ba? Okay lang yan guys. EXO lang yan. Okay, let's go. So, armamentarium. Let's go to your surgical burrs. So, these are your round burrs. We usually only use the round burr. This is the number 2. 2, 4. Kung napagpalitan naman. Basta 2 and 4. Number 2 and 4. And then, itong mga sharp ends, usually we don't use this kasi pag nag-penetrate kasi sa tissue, baka mag-through and through. So, we don't want to cut any vital structures dun sa oral cavity natin. So, this is safe for our bone recortication. Just use the round burrs. Okay, so for bleeding control, we have electrocautery, but we don't have this naman dito sa school setting. We only have this sa hospital. So, this is for controlling of bleeding pag may excessive bleeding. Okay, so next is for your bone files. So, lahat ng ipine-present dito, meron kayo dapat ha sa set nyo. Kung wala, pili kayo kasi kailangan niya. So, bone file, this is for smoothening no excess bone. So, after you extract the tooth, kakapain nyo kung may sharp structures kasi pag nag-heal yung soft tissue sa patient nyo, masakit yan. Okay? Makaka-cause siya ng redness or kaya inflammation dun sa patient nyo kasi especially when you're going to do your prosthesis after. Okay, so baka mag-complain ng patient nyo, Dok, masakit po. Tapos yun pala hindi kayo nag-bone file or nag-rupture dun sa sharp edges. So kawawa naman yung patient nyo. Okay? So yung bone file nyo, there's a small end and then there's a longer end. Okay, so we have the retractor. This is to retract the soft tissue or large tissues. Pero this one kasi may mga excessively, yung mga sobrang laki for skin or sa mga organs ng body. Okay? So we have the suction tip and the disposable suction tip. This is bili kayo nito. Ito kasi yung kasya dyan sa dental chair. This is the disposable surgical suction tip. Meron lang ito sa online or tanongin niyo yung seniors niyo kung saan nila bili. Yan yung ginagamit nila sa baba. This one kasi, this is the Fraser Ferguson suction tip. This is used for sa OR setting. Pero I don't know kung gumagamit yung dyan sa clinician sa baba kasi hindi kasya yun eh. Or kaya meron din sila binibili yung mataba yung end para dun sa big suctions. Pero mahina kasi yun. So this is the best, yung may surgical suction tip. Okay? So your irrigators, When you're going to irrigate plain NSS, may pinrovide naman kaming boxes of NSS sa baba. Pero you can buy your own kasi nauubusan sa baba kasi share lahat ng clinicians doon. Pero nagdadala naman kami. So, plain NSS only. Pag bibili kayo sa drugstores, bili kayo nung for wash. Kasi may NSS for IV, merong for wash lang. Yung for wash yung bilhin niyo. Okay? And then we're going to use 10 or 20 cc syringe with 18 gauge. Okay? By 2 or 3 para hindi kayo matagalan sa pag-irrigate. So 2 or 3 pieces of 10 cc or 20 cc syringe. Okay? So we have next the mallet and chisels. So the mallet, this is used for ito yung pinampupukpok doon sa chisel. Okay? This is perpendicular to bone for emergency instrument. Pero ito kasi yung mga lumang ways ng kasi wala namang micromotor nung araw, wala namang surgical burr. So, ito yung old way, nagpupukpok sila dun sa bone, but this tends to have fracture pag excessive yung force. So, for us, we will teach you how to use your surgical burrs. Okay? Next, ito yung medicine bomb and iris scissors to cut soft tissues or your sutures. This is a blunt end lang kasi to protect the vital structures. So, dito masyadong sharp. This is used kasi pang sutures. And this one, sharp ends. Sharp pointed end. Yung iris scissor. Check nyo dyan kung meron. Okay? Next, we have your straight and curved hemostats. This is to control the bleeding. We have the straight and then we have the curved. Okay? So, this one, the beaks are smaller and longer kesa doon sa needle holder nyo. So, this is your needle holder. Check nyo sa instruments nyo para makita nyo yung difference. So, we have the Mayo Hagar and the Matthew forceps. So, this is the Mayo Hagar for your finger grasp. So, we hold this one using your ring finger and thumb. And then to support the end, use your index finger. And then this one, this is your Matthew needle holder. This is just used for palm grasp. Pero for us, nasanay tayo sa Matthew, sa Mayo Hagar. Okay, so the difference ng needle holder sa hemostat. For the needle holder, yung ends niya crisscross to identify. So minsan nakakalito kasi yan, tingnan nyo sa nyo din. Sa suturing set, tingnan nyo yung striations niyan. Crisscross yung sa needle holder and then sa hemostat is straight. Ayoko makakita ng panggamit nyo na suturing is yung hemostat na. That's wrong. So baka pagalitan kayo ng ibang CI kapag na-interchange nyo. Ayan yung magka-penalty. Kung gusto nyo magka-penalty, okay. Okay, so what are the instruments to hold open the mouth? So we have mouth props. This, meron kayo nito. Mouth props or bite blocks. So the mouth props, this one is the inverted scissor-like. So pagka-open nito, this will close dun sa mouth ng patient. This is used to open the patient's mouth. Yeah. Next is your bite block. Familiar naman kayo sa bite block, di ba? Gumagamit naman kayo. So this is used so nagbabite yung patient. Okay, may small, may big sizes. Okay, next is your MPEs, your Seldin, Freer, and your Malt number 9. Yan, so this is your MPE. When I ask for your MPE, ito yun, Malt 9. Mucoperiosteal elevators. This is used to hold the tissues, yung soft tissue after creating a plaque. Okay? So, bili kayo ng Malt number 9 na may sharp yung end and then rounded yung dulo. Okay? Next is bone wax emergency instrument. This is for bleeding control also. Yan yung itsura niya. So, pili na lang kayo ng box and then hati-hati na lang kayo. Kasi malaki yan eh. I mean, it's a block na pa rectangle. Oh, rectangle to, diba? Yun. Tapos, hindi siya pinapak lahat dun sa area. You just cut a small part ng bone wax and then you put it dun po saan nag-bleed. And then you don't leave this sa area of extraction. This is not resorbable. So you have to remove it after bleeding control. Okay? Next, we have your blade holder and blades. So this is your number 3. We have number 1, 2, 3, pero usually number 3 ginagamit natin. Okay, so we have different kinds of blades. We have the blade number 10. Walang number 10. We have the blade number 10 used for large skin incision. Search nyo na lang kung ano itsura ng blade number 10. So we have blade number 11. This one. Used for small stab incisions or incising abscess. Okay, the blade number 12. This is yung curved or hooked area. This is for your mucogingival procedures when we're going to use your sulcular incisions. So this works with your blade number 15, especially when we're going to do odontectomies. So next sem, tuturo namin kung paano gawin ito. Pero if for emergency cases natin sa EXO, we'll use blade number 12. So dapat naka-prepare ang blade 15 and 12 nyo. Okay? So blade number 12 is for your sulcular incisions. And then blade number 15 is for straight lines when you're going to cut your soft tissues. Okay, so blade number 15 is most commonly used. So this is used around the teeth or through the mucoperiosteum. So against the soft tissue lang. Okay? And then blade number 20, wala dyan. This is used for skin incisions. Big surgeries. Okay? So this is how you handle your blade to blade holder using your needle holder or hemostat. So you will see pagka-open nyo ng blade nyo, this is the line. So it should be the same dito para sa pag-insert nyo, hindi siya mag-break. Okay, so it should be well adapted to your blade holder. Yan. So dito, and then, yan. So it has a locking, dapat nakalock siya dun sa blade holder para hindi dislodge. Kasi pag dislodge yan, syempre sharp edges, baka maka-injury kayo sa soft tissue ng patient. Yan, so loading and removal of scalpel. So, angle should be the same here. So blade using your needle holder, insert, and then when you're going to remove it, so hold it from the end, and then hilahin nyo lang pa outside. So don't remove it facing towards you, ah. So outside, always away from you. Provided na dapat wala kayong kaharap. Okay, baka hindi nyo nasaksak sarili nyo. Yung kaklase nyo naman yung nasaksak. Pag may galit kayo sa friends nyo. Okay, so this is how you hold the needle holder. So use your, try nyo. So using your, ayan, look at the striations, crisscross striations sa needle holder nyo. Pero sa hemostat, straight striations. Okay? And ang advice namin, you always use, ang needle holder nyo is personal to you. Okay? Mahirap kasi siya na pinapahirap, tapos hindi naman sana yung kung sino mga mahihirap sa inyo sa needle holder. So, pwedeng matagalan yung pag-suture. Pwedeng 5 minutes lang kayo nag-exo, tapos ang suture niya 20 minutes. Okay? That happened. Ito yun. Okay? So, this is how you hold the needle holder using your thumb and ring finger and then your index finger to support dito. So, ganyan. Okay? So, feel nyo, ayoko nakahawak yung middle finger nyo dito, ha? This is the misconceptions kasi. Yan. Mas may feel kapag yung sa ring finger and sa thumb. Yan. So, when you support the, when you engage the needle sa soft tissue, may adequate grip siya. Yan. Okay? And then this is used yung hemostat to to hold the end of your suture. Yan. Just to hold the end of the needle. Okay? So same, when you, the surgeon, you're going to use your needle holder, and then same for the assistant, ganun din ang hawak niya sa hemostat. Okay? So left, right. Okay? Okay. So same when you're going to use your scissors. This is the curved scissors. So binili kayo ng curved and straight iris scissors. Same concept, ring and thumb and index finger. Okay? And then when you're going to use your curved instruments, it's always when you're going to cut away from the soft tissue. Usually ginagamit natin yung curved para ma-protect yung mga vital structures kasi. Kasi yung straight na hindi yun nakikita kung saan pala naka-point sa mouth area. Okay? So, bili kayo ng curved and straight. Okay? Again, your chisel, mallet and chisel. Okay, so instruments used to grip soft tissue. We have your Adson tissue forceps. So, bili kayo. This is your Adson's tissue forceps. Cut pala siya. So, this has two types. Yung teeth, Adson tissue forceps with teeth and without teeth. So, yung teeth kasi I used to grasp, pero usually napupunit kasi yung soft tissue. So, we will use yung without teeth. And this is for longer grasp lang naman. This is your DeBakey forceps. Okay. DeBakey. D-E-B-A-K-E-Y. Or pick up. Pag sinabing pick up, ito iaabot niya. It's either Adson's or DeBakey forceps. And your DeBakey forceps comes in different sizes. May 11, 16, 18. Pero yung mga 18 yun kasi yung pang OB. So, pag pila niya na yung baby, yung mga malalaking forceps gamitin niya. But for us, pwede na yung 11 or yung 16. Okay, so when you're going to use your drape, you have towel clips. So, at least 10 pieces of this one. Tapos lagyan nyo ng engrave para hindi mawala. Okay, pati yung instruments nyo, lagyan nyo ng palatandaan ng mga tawag rings, identification rings, or engravement. Okay, so now there's for retraction, we have the Wheeler retractor. This is used to retract the tongue. So this also has 3 sizes, may small, medium, large, depending on the size ng sa patient. So, yan, kung may extra budget, pili kayo nito. Wheeler retractor. Okay, next, ayan. This is your freezer suction, for your freer suction kanina, and then your disposable surgical tip. So, for your freer suction tip, this has a hole. So, when you're going to suction hard blood sa hard tissues, kino-cover to for stronger pressure. Tapos kapag soft tissue bleeding, remove it para sa hindi siya maka-injure sa soft tissues. Okay? We usually use this sa hospital. Okay, so we have your forceps. So these are the parts of the forceps. We have your beak, your hinge, and your handle. So, na-mention naman to sa yung, diba, product presentations or kung hindi. Ayan. Beaks, hinge, and handle. So, what are your maxillary forceps? So, we have your forceps number 150. So, to identify yung the forceps of maxillary and mandibular, this one is for maxillary, curved downward. Meron kayong forceps dyan? Na hindi sterile. Okay lang hindi sterile. Yan, hanap ka ng 150. Or iba kasi yata sa sa average, parang 210, something. Yan. Basta yung naka-angle, pababa, pang maxillary. So, ayaw namin makakita ng panggamit nyo is maxillary, tapos ang binubunot nyo is mandibular. That's wrong. Wrong instrumentation, wrong extraction. So, instead na makabunot kayo, baka ma-fracture nyo pa yun sa ngipin ng patient. That happens. Okay? So, pag mali, baka ma-penalty kayo. Okay? So, kung pwede kami magpa-penalty sa inyo, hindi kailangan. Okay, so forcep 150 is used for maxillary anterior teeth up to premolars. So central incisor, lateral incisor, and premolars. First and second premolars. Forcep number 150. Okay? Next, we have your forcep number 53. This is, so observe nyo ha, yung beaks niya, this is medyo pointed, yung end. This is used for the palatal root. Okay? So this is used for right and left posteriors for retrieval of palatal roots. Okay? Next is your forcep number 210S. This is used for your maxillary second and third molars. Okay? So observe nyo yung beaks. Yeah. Usually may numbers naman siya. So you just have to know kung para saan. Next is forcep number 69. This has finer tips used to retrieve maxillary root fragments. So pag badly broken na yung tip niya, mas manipis to grasp your RFs. Anterior and posterior RFs. Okay, so the blade is curved upward. Next is your forcep number 65. So see the tip. So 65. And then this is 69, yung tip niya. Okay? So if you have, pero usually number 69 kasi yung ginagamit. Pero if you have, kung makakita kayo ng number 65, yan. Finer tips lang naman siya for maxillary RFs. Okay? Now let's go to your mandibulars. You have forcep 151. So yung angle naman nito is pointed downwards. Okay? So this is also used for, saan ulit ang forcep 150? Maxillary, central incisor, lateral incisor, and premolars. So ang forcep 151 for mandibular central incisors, lateral incisors, and premolars. Yan lang. Yan ang favorite ng clinicians, 150, 151. Okay? So, kung may maxillary, may mandibular. It's for your anteriors. Next, we have your, walang number to pero hindi ko alam kung anong number sa ibang brand. So, this is just for your mandibular molar forceps. So, straight handles, used for mga first and second molars. Left and right. Next is, this one is for your mandibular third molar forcep. Yung end niya lang naman is more fine. Mas mataba yung tip nito to grasp your mandibular third molars with crown. Okay? May blunt end lang siya compared to your previous na mandibular forcep. Okay, we have forcep number 16 or your cow horn forcep. So this is used for badly broken mandibular posteriors. Okay, badly broken crowns to grasp. So mas finer yung tips. So you adapt it to the bifurcation ng tooth and then apply force, then extract. So tips lang ito. This is cow horn forcep or forcep number 16. Or sa ibang books, number 23 kasi siya. Okay? So, if you have this one, for maxillary posteriors, kung sa lower, may 16 for both sides na, maxillary, mandibular forcep, cow horn number 16. Sa maxillary, ang opposite niya is 18. So, there are two types, 18L for 18 left, maxillary left posteriors, and 18R, maxillary right posteriors. Gets? Ano ulit pag 18L? Maxillary left. 18R? Okay, pag lower? Or tawag sa 16? Okay. Masali na kayo sa 44. Okay, so for step number 44, fine tip. That's a board exam question kung anong ginagamit sa OS or your validas. Okay, so for step number 44, this is for RFs, mandibular RFs, counterpart ng number 65 or 69. Maximum. Okay, number 44 for our mandibular RFs. Another one, this is an old forceps naman kasi. This is an English style vertical hinge forceps. This has stronger force. So usually, pwedeng mag-break yung mandible. Okay, so if you want to read more, nasa Oral Surgery by Franciscus naman ang reference natin. Okay, yung blue na book. Yung sinend ko, di ba sinendan ko kayo? Yan. Doon lang lahat ng reference natin. Okay, this is how you grasp the tooth. So, with the beak, adapt to the bifurcation. Lalaliman nyo talaga. Kasi kung superficial lang yung grip nyo, pwedeng mag-break yung crown. Okay? Which ends up in retrieval of the root. Pwede pa kayong mag-section ng magbawas ng bone or you have to cut the tooth. So, as much as possible, huwag nyo na i-break. Just adapt the beak to the bifurcation and then apply force, backalingual, and then extra. Ano yung dali lang. Parang madali lang sabihin. Okay? Next, we go to your elevators. So, these are the parts of your elevators. We have the blade, the shaft, and the handle. So, this is your straight elevators. So, if you buy at sa ibang brand, may 103, 201, 202, 203. Depending lang sa size. Minsan may 123. Different numberings lang naman siya per brand. Okay? So, this is your straight white elevator. Medyo curved lang naman siya sa end. So, this is for posterior maxillary teeth. So, we have also your crossbar T-shape. This is used to extract RFs root fragments. Next is your Selden elevators. So, extracting roots sa mandible. Then we have your double angled elevators or your root tip pick. Parang this one kasi sobrang fine niya, ginagamit na lang ito pang sungkit sa mga floating roots as much as possible. Kasi sobrang nipis niya, pwedeng mabali. Okay, we have your chompret elevators. I don't know kung meron pa nito sa mga sets. Pero this is in the book kasi. So chompret elevators, we have the straight and the curve. Next is the sharp tip angle elevators. Ayan. I think this is more expensive. Tapos sa ibang brand pa siya. Ayan. Pero if you can extract naman using yung forceps or elevators that you have, go. Okay? So this is your armamentarium. So when you're going to do your extraction, kami kasi if you're right-handed, so ang arrangement namin ng instruments is from left to right. Okay? So kung anong gusto nyo, basta alam nyo kung anong kukunin yung instrument. Pag hiningi ng surgeon, alam nyo kung saan kukunin. Okay? So ayaw namin makakita ng sabog-sabog lahat ng instruments. Okay? So your batch should be better than the higher batch. Okay? No pressure, pero lahat ng tinuturuan namin magaling sa surgery. Okay? Provided na nakikinig kayo, kasi syempre baka pumasok lang sa isip nyo, magaling na ako. So, no. Huwag ganon. Yes.
Pwede po yung kidney
Kidney basin. Pwedeng kidney basin. Kung gusto niyo yung pang baby, pang OB, okay lang. Kung anong kakasya dun sa drapings nyo. Pero kung may round kayo or kahit anong shape, basta lalagyan na ng NSS, okay lang. Okay? So this is your arrangement. This is for your main instruments. So if you're going to buy yung tawag dito? Aspirating syringe, at least 2. Para pag hindi na kayo tagalan. So buy 2 nito. Okay, tapos we're going to use Articaine for local infiltration. Nag-anesthesia na kayo, di ba? Subject. So, alam niyo na dapat yung mga different kinds of anesthesia. Carpules. Okay, so this is, ay, naka-zoom in lang naman. So, another tray setup. Yan. So, gauze. Bili pala kayo ng sterile gauze. Or, kung makatipid kayo, bili na kayo ng pack. O, kung pack, sige, kung gusto nyo. Pero kami kasi, we still cut. Minamano-mano namin yung gauze namin. Pinakat para, tapos i-autoclave lang. Yan. So, this is our actual tray setup. Konti pa nga to eh. So, this is the surgical main instruments. So, this is a different draping. Kaya, sinasabi namin, you have to have at least 10 drapes. Kasi this is double packing. So, dalawa agad for your main instruments. Tapos, dalawa for your elevators kung di ka kasha. And then, dalawa again for your forceps. So, 6 na agad yun. Diba? So, you also have 2 for emergency instruments. So, gamit na lahat ng drapes. And then, you also have to have sa drape pa ng patient. So, yun. Okay, so, ayan, this is your DeBakey forceps. This has different sizing. Seldin, Minnesota retractors, Wither retractors, mouth props, rongeur, scissors. This is for your pickups. This is your Alice tissue forceps to grasp lang. Needle holders, DeBakey, hemostat, tissue forceps or DeBakey again. So bone file, chisel, gum set, MPEs, blades, syringe, 4 basic. So in your set, mag-include kayo ng 4 basic ha. And at least 3 mouth mirror or 2. Thank you. Okay, so requesting for panoramic x-rays. So ayan, for this one, daming bubunutin. So anong mga instrument, anong mga forceps gagamitin nyo? For maxillary anterior, forceps 150, 150, mandibular anterior. Okay. For maxillary right, maxillary left, for mandibular, ito. Sige, pwede. For this one, badly broken, sige, 16. Pag RF, 44. Yan, alam mo na. Pag RF ng maxillary, yan na. Very good. Okay, next is your laboratory request. So this is your CBC with differentials. So kung normal ang patient nyo, then go. Makikita nyo naman, we request kasi minsan may maririnig lang kayong CBC. So kasi as we request for differentials to identify kung ano yung range, reference range niya. So if it's within normal limits, WNL, then you may proceed. Parang medyo sure kayo na walang complications patient. And we look at your prothrombin time for your bleeding time ng patient. Okay? So kung magiging madugo yung sa and bleeding yung sa patient niya. This is also for your PTT and HbA1c, sugar ng patient. So if it's within normal limits, then you may proceed. And then this is your cardiopulmonary clearance. So, pa-clear nyo sa internal medicine cardio. Then, ito yung nakalagay. So, if they have advice, ito kasi sa patient, so please continue Sangobion once a day. Follow up every 3 months. So, siguro, anemic patient. Okay? So, go to your simple tooth extractions. So, basic requirements. Inform the patient, know your anatomy, so review, detailed clinical x-rays, and then preparation of the patient. So, pre-clinical rinse, mga mouthwash, and then correct positioning of the dental chair. Yan. So, this is your position. So, kung right-handed kayo, right-handed. So, nasa 3 o'clock position, 2 o'clock position, or 11 o'clock position. Yan. Okay, so first step in removing a tooth using the simple technique is to sever or loosen the soft tissue attachment. So before you're severing this, we will anes the patient, pakasutukin kayo ng pasyente, yung sakit na yan. Just engaging an instrument sa soft tissue, marami kasing nerve endings, so masakit agad yan. Will induce pain. Okay, so we will just, we will teach you how to use the filtration technique. Yan, so using MPE, adapt the end sa gums and then just detach it from the bone. So, MPE pa din, mandibular. So this is how you grasp the maxillary forceps. So modified palm grasp. And then this is for your mandibular grasp forceps. Okay? So for extracting your maxillary teeth, adapt the beak on the CEJ or the bifurcation. And then pag may adequate grasp na kayo, move it labially and palatally. Okay, so for posteriors, maxillary posteriors, buccally and labially. Okay. So mandibulars, the same. Adapt the beak, adequate grasp, and then move lingually and labially. Pag nag-break, okay, so usually when you extract your, nakapag-pido na ba kayo? Pido extractions? Not yet. Okay, so pag pido extractions, you can use smaller forceps. May mabibili kayo for pido set. Pido forceps set, or usually kasi ginagamit nila yung malaki, pero usually it can break the adjacent tooth. So, may specially designed forceps naman for pediatric patients. And when you extract the tooth, usually nakasunod na kasi yung permanent tooth. So when you extract this, madali na lang siya. Mabilis lang. Okay, so mga ano yun naman yan. Experience yun naman yan sa pedo patient. Tapos kapag umiyak na, hindi na siya nganga. Kasi iyak na lang kayo. Dok, katulog ko. Okay, so this is how you grasp. This is how you hold the straight elevator. So we will use your finger guard. This is the finger guard technique. So using the gauze, protect the lingual part and then point the straight elevator on the tooth to be removed. Yan, for maxillary. And then this is for third molars, extractions ng third molars. Pero usually if it's impacted, it's already called odontectomy. Okay, so this is for your RFs. So we will use the crossbars or your root tip picks. And then this is for your emergency cases, pag kailangan mag-retrieve. So we'll use your round burr and your low speed micromotors. And then when you're going to use your low speeds, dapat naka-irrigate, continuous irrigation. Kasi wala namang water yung low speeds natin, di ba? So that's why we will require you to have at least 2 ng 20cc syringe para continuous yung irrigation nyo. Kasi pag hindi kayo nag-irrigate, that will lead to dry socket. Okay, so masakit yun sa patient. And there's no management for dry socket except for irrigation, hydration. Okay. Or resection. Tanggalan kayo ng pano. Yan. So, when you're going to do your elevator technique, so you don't use the adjacent tooth as fulcrum, just point it towards the tooth that will have to be removed. So this is for fractured this is for fractured roots. So if you are going to extract, so it's in the path of removal. So if it's straight naman, diretso lang yung removal. Okay? For mesially inclined, ang path of removal is mesially. Pag distally inclined, distal path of removal. Okay? So you will understand that kapag nag-odontectomy. Ayan. Okay, so retrieval nung gamit yung finer root tip picks. So when you're going to extract, don't forget to remove. Ito kasi abscess na to. So may cyst na siya. Pero if you're for our normal cases, we will use our curettes. Ano yung curettes? Yung long tips to explore yung apical area kasi usually may follicular sac na siya sa ilalim. So you have to extract the follicular sac because over time, pwede siya mag-form into cyst. Okay? So usually this is omitted by the dental practitioner. Tapos nagtataka sila bakit namamaga, bakit nagka-infection. Pero post-extraction, you did not irrigate, you did not clean the socket. So it led to complications of the patient. Okay, it happens talaga. May pumapasok sa emergency room at 2 in the morning, mamaga yung mukha kasi after extraction, hindi nagtanggal ng follicular sac. Okay? Okay, so sign na lang to. So, post-operative care. So, rest. Advise the patient to na-work for 2 to 3 days. Pero depends on the patient pa rin yung healing. Pag tinanong sa inyo, Doc, gano'n po katagal yung healing? We always answer the patient. Depende yun sa response ng pasyente. Kasi baka magsabi kayo, 1 to 2 days. Diba? Tapos yung patient hindi pala kaya ng 2 days, namamaga pa siya. So, thesis, laging dentist. Because you're the doctor. So it will always depend on the patient. Okay, so after resting, so analgesia, take medications, the prescribed medications if necessary, and then edema after surgical procedure, extraoral placement of cold compress. So syempre mamamaga yung extraction site ng patients nyo or if extraoral appearance ng patient nyo. So, just apply cold compress for 10 to 15 minutes every 4 hours. Okay, so bleeding control. So, before suturing yung patient nyo, of course, you have to establish hemostasis first. Baka naman kasi mag-suture kayo after extraction, may continuous bleeding, profuse bleeding ng patient, kinlose nyo na, pwede siya swelling. Okay? So, control the bleeding first, and then if hemostasis is achieved, you may suture, and then ask the patient to bite firmly on gauze. Yan. So, antibiotics, it will depend kung gaano katagal ang extraction nyo. But for our case, we have already established infection control, sterile yung area, sterile yung gamit nyo. Hopefully, wala kayong tinouch na anything that will cause the area to become unsterile. So, there may be no need to prescribe antibiotics. And the length of your surgery pala. So, yeah, if within 1 hour, so maybe we won't have to prescribe antibiotics. Okay, so diet, soft cold diet muna. Wala namang bawal. Pero soft cold diet. Okay, so oral hygiene, sabihin nyo sa patient nyo, or after surgery, magbili na kayo, patoothbrush nyo yung patient nyo. Sabihin nyo sa patient nyo, dalhin na yung toothbrush nila, then after surgery, toothbrush nyo yung patient. Okay, kasi expect your patient to not able, na hindi nila mabubuka yung bibig nila after surgery kasi may pain. Okay? So, oral hygiene nyo na rin yung patient nyo. Just brush, kahit mabilis ang brush lang. And then, ask them to gargle, and that's okay. Oral care. Brush nyo yung tangha, or scrape nyo ng gauze. Kasi mabaho. Pag may blood accumulation. Okay, so removal of sutures, how long? How many days for suture removal? 5 to 7 days. 7 days maximum. Pero according to the books, up to 10 days for your silk. Okay, for silk only 10 days. Kasi after 10 days, pwede na siyang kapitan ng bacteria, and then inflammation, and then infection. So you have to remove your sutures pa rin. Although may mga resorbable sutures naman tayo, but they don't melt right away. Mga 2 to 3 months pa yan natanggal. Okay, so for us, you can use your silk sutures. Basta naka-sterile siya. Na-sterilize. Okay? Okay, ano yan? Extraction of teeth. We'll be teaching you this naman pag na-exo na kayo. Okay. Okay, this one. So in cases wherein we have to retrieve your roots, kaya na-fracture talaga, or kaya may mga retained roots dun sa area, tapos hindi na siya accessible using your elevators and forceps. So we will have to create a flap. Okay? So in order to retrieve the root, medyo ano naman to, I think this is an infection case, pero yan. So just create a flap. We'll teach you how to create the flap. So removal. Ayan. So this is a flap with a releasing incision, but we don't usually recommend this one kasi yung healing niya pangit. So when you suture this one, baka magkaroon pa siya ng perio problems. Okay, so kasi magre-recede pa yung gums niya to adapt kung the amount of bone that was reduced. So if excessive yung bone reduction, baka over time, magkaroon siya ng perio case sa patient. So we will only perform envelope flap sa patient. So, envelope flap is just incising from an adequate space, adequate number of teeth, and then full reflection to expose the area of concern sa gums. Okay, so ayan. So after creating the flap, we have to reduce the bone using your micromotors and continuous irrigation. Tapos pag may adequate exposure na kayo or access, so extract. Ayan. Madaming cases sa baba na nagre-retrieve ng roots. Okay, so this is post-op, x-ray, ay, pre-op pa yan. Yan. So, RF, yan, to retrieve the root. Pero this has releasing incisions kasi, so pangit ang healing niya. See? Okay, so unless for envelope flap, we can use vertical mattress suturing. Okay, so this is your semi-lunar flap. Semi-lunar din. Ito, I think semi-lunar flap. Used for endodontic cases. So, ayan, this is the semi-lunar flap. This one. Just around the area, but you may use this as long as you know how the management of it and ma-close nyo yung soft tissue. So, take a picture of the teeth that you have to remove. So, compare nyo sa inyong x-ray. Baka kasi ito, yung apex na putol. So, check nyo pa din. After extraction. Removal. Or setting. Okay. Okay, now we go to suturing the soft tissue. So instruments, we have the needle holders. So alam niyo na yung itsura. And your suturing needles, we have different sizes. Ano mga nabili niyong suture? Sizes, 1/3, 1/4. So, depende na lang kung gano'n kalaki yung tutugin niyo. 3/8. Okay. So, one of of the most commonly used is our 3O black silk or 3O or 4O micril. Most commonly is the non-resorbable silk, so nylon, vinyl, stainless steel. Rarely used in the mouth, resorbable sutures made of catgut. Pero usually kasi it can cause, ano pa siya, it can adhere bacteria sa mga hindi siya silk. So it's really advised to be removed from 5 to 7 days. After 5 to 7 days. 7 to 10 days. Pero ano na yan, questionable na yung 10 days. Okay, your iris scissors, your curved and straight. Ayan. Okay. Suturing techniques. So this is a video.
Switch nyo lang yung needle. Then, after you switch or place the thread. Yes, yep. Ayun na, kasi square jab. Bala ka na doon, Jab, ha? Salamat. Lifesaver kita. Patay ako mamaya. Anyway. So, pagka nilagay nyo na yung needle, bubuhulin nyo. Ay, nailagay nyo na yung thread doon sa needle, doon sa eye ng needle, bubuhulin nyo siya. Naiintindihan nyo yan. Okay, kunyari nailagay nyo na, bubuhulin nyo na isa pa. At isa lang, para lang, kasi pag hindi nyo pinuhuli ito, pag hinila nyo, matatanggal yung thread doon sa needle. Tama? Okay, so yun yung gagawin nyo dyan. So, at least an arm's length. Okay, and then mag-ipon na kayo. Huwag niyong ilagay dito, ha. So, ilagay niyo lang sa miski doon sa inyong towels for drapes. Okay? Naintindihan? Or, ilalagay niyo like what Dr. Yabyabin, ganito, sa papel. Okay? Magpuputol kayo ng papel. Okay? And then, i-roll niyo. Kasi yung papel na yun o yung carton na yun, kung pwede niyo i-autoclave. Yan. Okay? So, just papasa mo na, may extra kang ganyan, Dr. Yabi. Okay, ipasa mo na lang para makita nila. Now, mamaya na. Tingnan nyo na muna dito. So, first and foremost, after you make the incision, we're going to perform muna this is a periosal elevator. So you're just going to undermine.
Before kasi, ito yung suturing pads namin.
Pero yung sa inyo,
So we
hindi
have
mo
to
na
cut
gagamitin
in
yan.
size.
Okay?
Yan kasi yung mga ready,
So,
ready na siya.
undermine nyo lang para mas madali mag-grasp yung tissue. Okay. We're going to do first. Okay? This is an Adson's corset. Hindi kayo gaganoon, tapos gaganon ninyo. Okay? That's the reason for the Adson's corset. You pick up the tissue.
Yung mga videos, bawal nyo i-upload yan na it's only for
You pick up the
personal
tissue.
use. Kung ano na to,
Okay?
pang CEU lang.
So now, if this is the incision, like so, this is the incision, okay? You try to make it tingnan nyo ha. So 5 millimeters apart. Kunyari, here, one side muna. And the needle should be grasped at the middle. Hindi dito. Hindi dito. Sa kanyang dito. Butt end. Should be at the middle. Malinaw. And then, slowly, 5 millimeters away from the incision line, like so. Still, hindi ko ginagrasp with my bare hand. And then, you can use your hemostat to hold the tail. Para, pagka nahila nyo ng sobra, titigilan ng hemostat. Yes? Hold the tail. And then,
Dami na. Hindi ko pa ginulit.
another. One side lang guys, alright? Naintindihan? Look at me. This is the only time that I'm going to hold it just. Why? Kasi ang nangyayari, doon sa iba, hihilahin. This is wrong. Kasi magkakabuhol-buhol yung gagawin nyo. Okay? This is wrong. What are you going to do? Okay. So you can put this back. Madali, di ba? Okay? Be systematic. Bago nyo hilahin, please, siyempre naka-glove na yung hand ko eh. May glove hand yan. Like so. Kailangan yung tail should be as short as possible. Kasi pagka yung tail mahaba, pag pinutol nyo, ganitong kahaba yung masasayang sa suture nyo. Malinaw. Step by step tayo. Hindi kayo, meron kayo hindi naiintindihan, sabihin nyo na sa akin ngayon. The tail should be as short as possible. Yes? Now, we're going to do the surgeon's knot. Two clockwise. 1, 2, and then tie. Okay. BBT1, usually may assistant ako ngayon. BBT1 ko na muna. So, dalawa counterclockwise. 1, 2, hold the tail, and then, hindi gagalaw yung right hand ko. Tingnan nyo, this is my right hand. Ang gagalaw lang is yung left hand. Yung first knot. 2 clockwise. 2 turns clockwise. Now, 1 turn counterclockwise. So, counterclockwise, pag ano naman. Ito ang clockwise. Okay? Kasi baliktad. Mirrorin nyo na lang. Ang counterclockwise, pag ganito. Okay? So, 1 counterclockwise. Again, hindi gagalaw yung right hand ko. Hindi gumagalaw yung right hand ko. Always lang free hand. Kung kaliwete, sino kaliwete rito? Okay, baliktarin nyo na lang. Okay? Yung dominant hand na lang ang sasabihin ko. Okay, hindi gagalaw yung dominant hand ko. Okay, and then, 1 turn ulit clockwise. Again, di ba? 2 turns clockwise, 1 turn counterclockwise, and then 1 turn clockwise. That's the surgeon's knot. And then 1 turn clockwise. Okay? This is the surgeon's knot. And then you can ask, or if you want, cut, like so. And then you can ask your assistant, whisker. Pag sinabing whisker, 3 to 5 millimeters above the knot. Yung haba. So 3 to 5 millimeters above the knot. Cut. Malinaw? Okay, iyaano natin.
Okay, gets na? Kailangan nyo ng demo. Actual demo. Pero na. We have 5 kinds of suturing techniques ha. We have the suturing, we have the continuous locking, horizontal and vertical mattress suturing technique, and figure of 8. So, gagawin nyo na. this is your continuous locking and horizontal mattress.
Multiple extraction. Mali yun. Okay? Always remember, if you're going to, what you call this? If you're going to do the knot, kailangan one side ng knot lang. Kung baka lang lahat, baka lang. Libya lang, libya lang. Lingwa lang lahat ng knot. Hindi yung libya. Mali yun. Okay? And then, okay, i-fast forward ko na, counterclockwise, isa. And then clockwise, isa. At this point, hindi nyo puputulin yung non-dominant hand. Putulin nyo lang to. Look. So, this is continuous lang. Okay, continuous. What you're going to do, 5 millimeters apart pa rin. Usually, ginagamit ang continuous pagka nag-alveolectomy kayo, multiple extraction ng anterior, posterior teeth para hindi masyadong marami yung knot. So, 5 millimeters apart. Guys, i-fast forward ko lang to, ha? You see, it's 5 millimeters apart, 5 millimeters away from the incision line. Flexo. Same side. Kung saan ka nag-stop, doon ka sa side na yun mag-start. Okay? And then, 5 millimeters lang. Ilu-loop nyo lang siya. Okay? Loop lang. 5 millimeters. There. Kita? Again, 5 millimeters apart. Magdadiagonal yan. Okay? Hindi mo naman po pwedeng gaganon siya. Talaga magdadiagonal siya. Okay? Then, Madam President, later ha, don't forget the USP, okay?
USB sila pa sila nung araw.
Yes? With the principal? Now, how will you lock? So this is, okay, 1, 2, 3, 4. One more. See how my hand, okay, steady siya. Okay? Relax lang. Huwag niyong titigasan yung inyong wrist. Huwag niyong plasuhin. Okay? It's all finesse. Okay? So now, before niyong i-pull, look at this one. Guys, before you pull, di ba? It is as if you're doing interrupted. Ganito niyo ilalak. Okay? 1, 2, yes? Very good. Okay, bago nyo i-pull, huwag nyo na i-pull, at least yung tail, ganito lang, around siguro an inch, yung tail. And then, counterclockwise, isa. And then clockwise, isa. And then you cut. This is continuous. Okay? Hand-eye coordination. Then
Is
clockwise, isa.
continuous interlocking.
Cut. And then So 5 millimeters apart, guys. Okay? There. It's all about spacing. Kasi hindi porkit marami kayong suture ay maganda. Di ba kanina, pupul lang natin. Tama? So we're going to get, okay, the needle underneath. Like so. Yes? Ganyan din yan. So, ang purpose lang sa continuous locking, kailangan continuous traction lang. Ito yung trick yan. Kasi pag maluwag yung isa, lahat maluwag. This is the trick here. Kailangan yung lock nyo, pull mo lang to. Pull mo lang, constant lang. Okay, from here, 5 millimeters apart. Again, ano lang ito shortcut lang. So you get underneath. Pag sinabi ko sa iyo, release.
Dito. Saan kabila na kayo?
Yes.
Hanggang ano pa tayo? 10.
Pull.
Pero may break kayo later.
Pull.
Ayan, sige sa kabila.
One more, then i-ano natin. Ilalak na natin.
May gas pa lang dito.
So, then,
Balik